last
Recording in
session, we
progress.
unpacked the good, the bad, and the ugly of food security in South Africa, lifting the veil on how food security and social stability are interconnected. A strong focus was placed on how to broaden access, improve affordability, and increase availability of locally produced fare. Our panelists in our last discussion highlighted the contrast prices of food versus the level of income, emphasizing that food at retail level is unaffordable to most South Africans. Now, access to safe and affordable food is critical for the survival of both humans and livestock. And with COVID-19 dominating the news and our lives for the past 2 years, it's easy to forget that food safety also has significant impact on public health issues, and statistics show that more than 200 foodborne diseases threaten South Africans and people across the globe. Now, food safety is often overlooked in areas suffering from famine, starvation, and malnutrition, and these areas are also associated with poor hygiene, lack of access to clean water, and properly washed and prepared food, which can be a death sentence when coupled with the associated lack of sanitation. Now, today, our panel of experts will shed some light on the issues surrounding food safety in South Africa, and we're looking forward to an open engagement with our participants who can engage with us on our chat box available. So please feel free to share your questions, pose them to any of our panelists, and engage with us on this discussion today. Before I hand over to our host, FairPlay founder Frank Verbed, I'd like to introduce our panelist who is here with us. I would like to welcome Motlong Sitati. She's the executive of the Consumer Goods Council of South Africa's Food Safety Initiative. She has over 15 years of experience in the South African food and agricultural industry and 10 years of service in the public office at the Department of Agriculture, Land Reform and Rural Development. Welcome so much, and thank you so much for joining us. For the past 8 years, Dr. Hein Nel held the position of Executive Director with the Food Safety Agency. Dr. Nel has traveled the country to lecture on zoonosis with emphasis on diseases, secondary meat inspection, rural slaughter, and practicing veterinary public health. And finally, I also welcome Professor Chris Willems. He's a biologist and the current CEO of Botlali Village, an incubation center in the Belgian campus in Pretoria. In South Africa, and it's a pioneering community-based participatory IT knowledge enhancement in Africa. Francois, we have quite a bit of ground to cover today, so I now hand over to you to kick off the discussion for us. Thank you so much.
Thank you, Dawn. You're such a generous host to all of us. I really appreciate it, and I'm sure all the panelists are very happy to have you steering the ship here. We decided we're going to have a conversation instead of a formal webinar with slides, and we have to wake everyone up afterwards. But to have a good conversation, it's perhaps important to just explain why FairPlay is so exercised about food safety. As you know, we founded FairPlay because we became concerned about the effect of dumping, which is when certain parties sell products in South Africa either below the cost of production or below the price they sell it in their local markets, or when food is, particularly food, is subsidized by the government. And we know that many governments around the world have ways of providing support and subsidies to producers and to farmers in their countries. That's their right, but the effect of these practices in South Africa and all across Africa is that those at the lowest rung suffer the consequences first. So when a producer closes down a plant or a farm, a big commercial farmer has to go out of certain business, for instance, in the chicken business, you will find that the people who lose their jobs can't find new jobs, mainly because very often food is produced in rural areas where jobs are scarce to begin with. The second thing we discovered is that there's a huge impact on small-scale rural farmers. And in South Africa, that means black farmers. And that they are subject to dumping, and they're subject to all kinds of rules and regulations that are not applied to importers. And so it keeps them less competitive, and it makes it difficult for them to provide food where it's most needed in poor communities. And then lastly, we have come to the conclusion that all of this is a form of predatory trade. And so what happened, for instance, in Ghana, when their local producers were wiped out, is that poultry in Ghana is more expensive than steak in South Africa. This is according to a USAID study we saw that was done in 2017. And that's what we have to prevent in South Africa. It also means that food safety is not only an issue for consumers, it's not only an issue for the academics and health community, but food safety is also very important from a trade perspective. We've already seen listeriosis resulting in deaths in South Africa. So it's important for us to get it right. And the panel is excellently credentialed to help us understand what must be done in South Africa to get it right. And hopefully by the end of this call, we will have had a conversation resulting in some real action that could be asked for. But perhaps I could ask Matlu from the Consumer Goods Council to talk to us about the issue that she sees. How do consumers know that the food they're purchasing from a retailer is safe? I referred earlier to the really dreadful tragedy we had with listeriosis in South Africa. So how would they know that food is safe when they buy it from a South African retailer, large or small?
Thank you so much, and thank you for having us as the Food Safety Initiative of the Consumer Goods Council of South Africa. And I must truly agree that food safety is not a responsibility for one part of the value chain. From farm to fork, we are all responsible, including the consumers. But in as much as consumers are a part of this, as you mentioned, at a retail point, there is no way as a consumer, if you're shopping, you can take a product and then send it to the laboratory to confirm if the scientific side of things, the chemical, the physical, and the microbiological hazards are okay in terms of your product. However, the simple things that consumers can do, and I think the assurance before we get to the consumer that we have in South Africa is that South Africa is a highly regulated, especially the food sector. It's highly regulated. We've got a number of regulations that we have in place from the departments, the various departments that are working together in terms of ensuring that food safety is maintained. And I think we're sitting comfortable that most of the role players in the sector are doing their utmost best to make sure that that is attained. But just on the consumer level, I would say as a consumer myself, even though we work with manufacturers and retailers, simple things like knowing how to read your labels. First and foremost, the date marking is quite imperative. We can't stop preaching about that particular education in terms of best before date. What does it mean? Expiry, what does it mean? So in essence, you need to look at your label. And I like this aspect of date marking because it affects a lot throughout the value chain in terms of your food waste and how you manage the food once you have purchased it. Take, for instance, food that has passed its best before date. That's where I shop. If I find a shop like that, that's where I shop. I get a product that is past its best before date. If I read the label and I'm informed that when I get home, the instructions say, store it in a dry condition, not high temperature, that's what I would do at home. So labels are a critical aspect in terms of how we manage our food products. And also when you get, I know we've got energy problems in South Africa in a case of where people don't have generators and they're not able to maintain the temperature in their stores. When you get home as a consumer, just let's say, for instance, they might have missed that point of quality control or quality assurance. You get home, if you defrost in a refrigerator as safely to do so, you can smell, you can look at the product. Is it slimy? Are the cans bulging or are they having any leakages at the bottom? So that is the advice that we normally give to consumers, that simple check, that's how you can do it.
Oh, the famous smell test. We at FairPlay smelled a rat when we started seeing packages of frozen chicken that says it could come from 7 different countries. And we were delighted when that was outlawed by government in the master plan and signed up to by everyone who participated in the poultry value chain. But Chris, I think you have guidance for us on whose responsibility is food safety. How do we bring about greater food safety? And if you could, how do we know that the safety practices of imported product is the same as the safety practices locally? Because Matlu said it's highly regulated.
Yes, I would like to pick on 2 elements which has been said by Matlu. It's one, it is a concern of everyone from farm to fork. That's one thing. Secondly is, yes, how do we know what testing, what does that exactly mean? If you go at the international level, basically food safety management as a holistic global concept is based more and more on what we call risk analysis. And that is part of what we call policy level. And policy level is basically government. What does that include? It includes risk assessment, which is usually science-based, it's scientifically research. It's risk management, that's policy-based, and it's risk communication. It is basically involving all stakeholders, and that these are essential responsibilities of the government. What is the output of these responsibilities is what we call objectives for implementation, because at the end you have operational, the food business operators, they have to practice these or just try to reach these objectives in their daily operations. And these objectives are guidance. And one example would be the microbiological criteria. We can discuss this about the sense and the nonsense and how these criteria are generated worldwide in technical committees. But there is also, if you talk about trade perspective, is the accepted level of consumer protection, which must be very clear. Now, in reaching all these objectives, you find all over the world, and if you say that in South Africa things are very well regulated, it comes down to different, let's say, systems. Whether it is the introduction of hazard analysis critical control point, which focuses on processes and on product, which is usually production businesses. Key of everything is good hygiene practices. We call that the prerequisites. And if you do not implement them very well, whatever level, if it's a multinational corporate or it is at the rural community of production, it's good hygiene practices, which are very important. And it doesn't make sense, by our experience, to bring in a system to, if you don't have these good these prerequisites in place. If you look at the production, the farmers, the good agricultural practices, if you look at them, most of them are focusing on hygiene. And in our project in Europe, looking at the different production chains in fresh produce and fruit, we have seen that there is a real critical issue, many of the issues at farmers level. And even the recommendations of that EU project was we might think of bringing in more principle of hazard analysis control points in GAP. But okay, that's an element of discussion. At the end, it's about integration. And okay, at the level of your risk assessment, you have your hazard identification. You need to identify what are the health, which agents, whether it's biological or physical, is a risk for health. You have the hazard characterization, evaluation of the nature of adverse health effects. It's exposure assessment, evaluating the likely intake of these. It's risk characterization, estimating the probability of occurrence or severity. And it's then the government has to come with that statement of purpose. Now, these elements, exposure assessment, risk characterization, are typically challenges in the issue which is discussed today. How do we come to that kind of risk assessment for rural communities in a way that they do not be eliminated in the whole economical activity? And evaluating the likely intake is completely different. And I can give you an example. When we did some audits in Czechia, we had McDonald's full integrated, complete compliant food safety factory. And next to the same plant, we had the production for rural communities. It was absolutely completely different, indicating that in terms of some of your risk assessment objectives, you have to look specific. What are the problems? Okay, hazard identification. We know the different bacteria or viruses who could be a risk for health. The nature of the adverse effect, we know them. That's already done. But particularly the challenge in South Africa for your rural communities, what is the exposure assessment? What is the risk characterization? And how do you bring that as a government in terms of your statement of purpose? And then indeed, you have the different, as we say, the risk management in itself is defining basically your policy alternatives. And one of them is based, if it's about food safety, is the so-called microbiological risk management, the MRM approach. These are things also define your accepted level of consumer protection that can be in South Africa, but is very critical in imports. You need to define clearly the accepted levels of consumer protection. And okay, at the end, my food business operators have to implement these things through implementing their good hygiene practices, the prerequisites. If they want to or have to implement HACCP and the food safety management, the 22,000, which is usually for corporates. Most important in the EU experience is that bringing in all this management system was a very a risk for small businesses in terms of adaptation. A lot of the small businesses disappeared because they didn't have the guidance. That's why in Europe we developed the sectorial guidance documents, but a lot of the small companies did not have the facility, infrastructure, the money to implement this. Keep in mind that EU at a certain moment had to bring in flexibility. And this is also an issue. If you look at rural communities in South Africa, what flexibility can you bring in to make sure that they stay competitive?
Well, that's a very interesting point on which to ask Hein to participate in this conversation. Hein, you're in the food safety business. It's what you do every day, and we've just heard a really wonderful exposition of the system of food safety and how to bring about food safety. And when even in Europe, highly developed as it is, there was a need to make a special focus for the needs of the rural communities. What is the case in South Africa? Do you see food safety practices as being at international scale? Do you see a difference between rural and local? What does it look like to you?
Thank you, Francois, for the opportunity, and to all your viewers as well. From our side, we're more involved in the practical side of things in terms of food safety. So we're less to do with policy making and legislation, but more on the practical implementation of such on the food safety at grassroots level. So we have a lot of personnel right across South Africa involved in especially meat inspection and classification. We do a lot of agricultural product standards work. But to us, the dilemma on food safety worldwide, very much the same. It's got a lot of similarities to it. To answer your first question, what's the standard in South Africa? I think the standard of food safety implementation in South Africa is comparable to the best in the world. It depends on which product you are looking at specifically. If you're looking at raw product, primary raw product like meat and raw meat, we're talking abattoirs now, rural abattoir slaughter, then we may have some deficiencies that is still out there, same as in the rest of the world, as was mentioned. But there are other risks that sometimes are overlooked, especially on a practical level, at the point where food safety is supposed to be implemented. One of these, just to give an example, would be doing meat inspection, removing the inedible, the unsafe food from the edible or the safe food, and then afterwards not taking adequate care of destruction or proper destruction of condemned materials, because these things may end up back in the human food chain, and that is the risk that we perceive, especially at rural level, where condemned products are sometimes removed, but it may end up back into commercial trade for whatever reason. The security of the destruction of these products were not properly overseen. So the risks to us would be removing it first from the food chain, and this applies to imports as well, where we would remove it from the human food chain as unfit for human consumption, and then taking responsibility for these products until it's properly destroyed.
Hein, that's a very interesting point you make. And we see a sort of a theme arising, which is that South Africa has good regulation, that in practice, there's a lot of work that must be done to ensure that all the food safety elements in the system operate efficiently and optimally, that we provide flexibility, but we also assist rural and small-scale producers to comply with these rules and regulations. But we're very exercised as well about imported product, because our question is, whose word do we take that the imported product is really as safe as it's claimed to be? When you see a product from 7 different countries in one package, we knew that was wrong because the traceability couldn't be there. So traceability is an issue that's now been forbidden, that practice of packaging. But we want to see inspections happening at point of origin. Because if I understand you correctly, Hein, most of the inspections on food is done for South Africa at point of origin, but for imported food, it's somewhere else. Matlu, do you agree that the point of origin is very important from a food inspection perspective?
I would say indeed, in a sense of the trade agreements that we have as a globe, each and every trading partner needs to respect its local market in as much as they respect their export market. So in a manner of fairness, fair trade in the global sense, each and everyone has to do their part where the product comes from. However, countries, they have a full responsibility to protect their own consumers, in that whatever that comes in, they need to ensure that there are track and trace mechanisms, they are working relationships with the other side of inspection. And we know we do this quite well with entities like your PPCB, who do cold chain inspections before products leave for other markets. So it would be fair for other countries to also afford the same equivalence and recognition for those practices. But I think, as you mentioned, the issue of traceability is quite critical. And I want to bring in the aspect of GS1 global standards, which are pivotal in the conversation, in that at some point in an awesome world that we all wish to have, we should know how many companies are bringing or registered as imports to come in. And I remember during the height of COVID, when things were at the height, some companies could not even find their consignments at the ports of entry. So that tells you that we need to fix our traceability. We need to know where each farm is, where each processing facility is, who is the importer, in the nicest sense of things. And this is the capabilities that we can do under the GS1 standards. But again, it needs the acceptance from the sector and from the policy makers to say, how can we work together and effectively to ensure that we give all of these mechanisms to the supply chain to work together. But indeed, as you're saying, because it's a great concern for fair trade and what you're advocating for, consumers deserve the right to know exactly where their products are sourced, in as much as they are concerned with labor practices in those companies, sustainability practices in those companies, environmental impacts in those in those countries. So all of those affect the whole value chain in terms of the people should know, and also the regulators need to know, and also it helps also in the ultimate sense of traceability for the people that get supplied with those products. I always wonder how it is managed, but with the traceability efficiencies, possibly they are able to do that. But I guess the writing is on the wall as to how that gets managed. If you have to trace a product being one with a lot of portions in one, but if you can do it perfectly and you can prove beyond reasonable doubt that this portion is from Holland, this one is from France, and this one is from wherever, the regulators will have to decide. Thanks.
I think that's a very important point, and it comes back to regulation. We have a question here from Roberta Burgess, who asks, whose responsibility is food safety with respect to the informal sector, where people are buying and cooking out in the open and selling food? I have fond memories of street food, as I would call it, all over the world, and enjoying street food that's safe, including in Johannesburg, and having the ability to sit down with people locally and have a meal on the pavement. But it is a concern to people. Food safety is a concern to people in the informal sector. So, Chris, how does that happen? The informal sector, we know it's government, but how do they do it?
If I go back to the European situation, there is an exemption for farms producing locally and selling locally, meaning exempt from the ASAP food safety regulations. Then the question, of course, is what do you call local? What is local production? And basically, it's local use, and that's something you have to decide on. Meaning, there is a difference of approach in these situations. But again, even if you would look at someone who organizes a braai or any activity outside, inside, preparing food for many guests, it comes down to the good hygiene practices. And whether you have to implement them, your prerequisites in your corporate structure, or you have to do it at the family level, it's exactly the same. Everything starts with good hygiene practices, which we call in a food safety management system the prerequisites. And it's called prerequisites because if you don't have to implement them, all the rest doesn't make much sense. There is also an issue I would like to elaborate on, the testing. I mean, you have, okay, as we said, the government has to come with these implementation objectives. How can food processor businesses just implement these through different systems? And one of them is validation validation or particularly more and more self-assessment. Self-assessment comes down to, can you prove through testing whether your processes, one, are under control, and do you some kind identify risk of health pathogens? And you have the so-called microbiological criteria. And Hen, interesting enough, mentioned you have to look at different types of food. If we talk about microbiological risk management, it's about looking at the different things apply differently in terms of microbiological criteria, depending on the type of food and the way it is processed. But about traceability, what Atlu says is right. It comes down to being able to trace, but I remember the discussions also with Dani before. He said, we have import and let's say salmonella. To be very honest, as a microbiologist, salmonella free is a utopia. We say no, well, we say no salmonella based on a certain statistical approach in sampling, but it's still kind of, the question is there, all these microbiological criteria, which are developed particularly in the EU in technical committees, which at the end are a balance, political balance between scientists and governments. The question is, and it refers back to your issue, are these microbiological criteria, are companies capable of performing these? The problem is you can scientifically decide in terms of microbiological criteria, this has to be the rule, but you see in many situations, producers are not, their processes, infrastructure is not capable of reaching them. And then you have to make that difference between those parameters you can use to monitor and prove that your process is under control. Doesn't mean that you identify risks of pathogens, but there is a new dimension to traceability at the microbiological level, is basically genotyping. And I used in my career as a microbiologist to defend this years ago, but the best proof of feasibility of traceability at the level of the kind of genotype variants of pathogens that come in through import is what COVID-19 is proves that. We constantly trace and track, and we can microbiologically prove that if I find a sewage plant, an E. coli, I can almost identify from which cow it is coming. This is what we call source tracking. This is a new dimension which people have to look more and more in terms of import. Prove that this kind of variant of salmonella comes from Peru, comes from, well, we do it already with fish pathogens. That's another aspect of traceability.
You know, it's so interesting how the science develops, but how important it is for ordinary people to still practice what my grandmother used to teach me, which is cleanliness is next to godliness. And everything has to be properly cleaned. But Hein, there are people who practice that. I've seen it on the street as well. I've seen informal vendors taking really good care of the cleanliness of their utensils, of making sure the food is properly cooked in a hot pan, for instance, that the pup doesn't stand overnight. It's whatever they don't serve that day is not served the next day. That things are washed. Those things happen with people with good intentions. But we've also seen food safety scandals. We've seen food safety scandals in Brazil, for instance, quite a few of those. And that's why we at FairPlay believe that inspection at point of origin is very important. And we say that also because I see there's a question from Isaac Breitenbach of the SA Poultry Association to say, are there many importers and processors not paying to be inspected and preventing inspections? Hein, you're involved in that world. Can you tell us? Does that happen?
Well, locally, I think the whole poultry industry has now been exposed to independent meat inspection, and it's performed through assignees like ourselves. So the local standard is in place. As far as imported products are concerned, they all enter the country under legal veterinary import permits. And of course, it is an international requirement that these products must be certified by a veterinarian at the plant of origin. And we give very specific requirements, we meaning government, South Africa, as to what is required from these products in terms of bacteriological standard, in terms of food safety standard. And of course, we would like for imported products to have at least the same equivalence in terms of quality and safety as our local products. Maybe this answers the question. If there's anything else that you may still be needing, any detail that I may have missed.
Rancho, maybe we can bring Matong into the conversation around the consumer and also around best practice for people who purchase food. I think she highlighted in the beginning, but if we could maybe move the conversation a bit towards that, some of the things that consumers should be aware of in terms of what happens when frozen food is stored and refrozen, things around that, so that you can take responsibility for yourself as a consumer as well.
Matlu, I think that was directed at you by Dawn. Why don't you respond to that point that Dawn made?
Oh, thanks for that, Dawn. I was still enjoying what Dr. Hein was saying and the conversation that was sparked by Isaac. So I think with the issue of freezing and defrosting and thawing and refreezing, I think we need to look at it with the utmost basic side of things, especially if we are to pose this at a consumer level. And the WHO makes perfect guidelines, and we have adopted that as the National Department of Health has also adopted that for South Africa in terms of the 5 keys of food safety. As you say, Francois, your mom is quite correct. The principle still remains. You need to be clean in everything that you do, more specifically with water and food. And the issue of temperature is of utmost importance in terms of how we manage the temperature of the food during delivery to the processing plant. As a raw material analyst in my previous years, we used to do thorough inspection before products could come in. And I would believe this would apply to at the ports of entry when food comes in. It needs to be at a certain temperature, either the core temperature of that particular product. And our local regulation, the hygiene regulation R638, specifies exactly how you need to manage that particular type of a product, either as a raw material or either during processing. If your processes internally are saying you need to thaw and then further process into other products, you need to follow the GHPs that Prof was talking about, the GMPs that Prof was talking about. So if you miss a spot, anything could go, it could go left or could go right. So maintaining those and making sure that the temperatures that are prescribed, the 5 degrees for refrigeration, the minus in terms of your minus 18 for your frozen refrigeration, and the core temperatures as guided by regulations in terms of before you can further process, you maintain that. And I think the comfort that we have is that Prof mentioned this, the science that is backing the regulations, because we can sit around the room here, but the regulators, as the regulators that have got the mandate to protect us as the sector and as the consumer, they need to do that risk assessment, risk analysis, and determine what will work for South Africa. If we pick up in research that this particular amount or exposure, as Prof said, is not satisfactory for our consumers, we need to avail that to the regulators to say, we propose that this gets to be changed. And I think a number of regulations have changed based on science. So I think we just need to follow all of those key principles of food safety, refrigerator temperature, freezer temperature. During the process, what is the process that you follow, and manage the critical points in terms of all your processes.
Lihle makes a very important point related to all these practices to say, but how does this help to combat food waste? Because I worked at a restaurant and I saw how much food is wasted when it should be donated. And of course, if we get the basics right, that is what is required, because then we can donate food and it's safe and we don't make people sick. We feed them. We help to nourish them. At the same time, there is a concern about infrastructure. Susan Marais says sewage systems are in shambles, even in major metros such as Tshwane. And she expects the Consumer Goods Council to help ensure this does not contaminate SA's food. I think it's a concern for all, and it's something that should be tackled. As you were talking, Matlu, I thought to myself, maybe the retail industry should employ grandmothers, because grandmothers don't miss anything. If you want inspectors, you need grandmothers to inspect everything. They won't miss a thing. They're going to give you a hard time. But I recently saw, Hein, that there was an idea to employ retired veterinarians to beef up, so to speak, if you'll pardon the pun, inspections at point of entry in the harbors and at airports and so on. Is that plan underway? Do you know about it?
It's not a formal plan yet. We are waiting what is authorized by the Department of Agriculture. Obviously, we can't just go ahead and do what we feel we must do. We currently do employ a couple of these guys already. They are quite happy to assist with food safety controls. There is a dispensation letter out currently from the Department of Agriculture following the KZN riots and the destruction of cold stores there, that we handle more of the products through Port Elizabeth and Cape Town. And obviously, just by diverting extra work to these harbors, there was a need for extra personnel. We have deployed them. They are currently busy in the harbors doing the work. So they, from our point of view as an assignee, we're very happy to assist government in their mandate of control in terms of food safety and quality as well. I must always put these two together, because food safety and quality is like brother and sister. They don't. You can't have the one and not the other.
Food safety and quality. Everything you've said so far leads to the point where we say, isn't it perhaps time to get a food safety agency, a national food safety agency with teeth, with statutory powers? It's already government policy to establish such a national food safety agency, because that could be helpful to even identify problems with infrastructure, because it's part of government. And Chris made that point very clearly, to say it's government's role to make sure that food is safe, and industry has an important role to participate. And we know that there are bad actors and that things are not inspected at the ports as it should be, because of reasons that people may understand and some reasons that people may not feel are valid. But a national food safety agency could become a solution if it is established, funded, and properly the right personnel, properly stocked with all the right technology. It was very interesting to hear about genomics being used. So all of this means that a national food safety agency is a huge undertaking. So I'm going to ask each of you, what do you think should be part of a national food safety agency? What are the components? What is the role? And how quickly should it happen? And I'm going to go again first with you, Matlu, to say, from a retail perspective, how do you see a national food safety agency?
Yeah, I think we've been talking about this for quite a long time, and I think during Listeriasis it was quite motivated that we need to maybe change the way we work in South Africa, but we know for sure that no one system is perfect in terms of food control. It can be a decentralized food control. It can be a one agency system. It can be a shared responsibility, either utilizing the private sector to make sure, like, let's take, for instance, laboratories where the enforcement agencies will appoint the private sector laboratories to help them in the facilitation of food control. So, but I think what is utmost critical, and I like the document that has been developed by the FAO in terms of monitoring and measuring food safety, because we all know that what gets measured gets better managed. If we know where we are standing as South Africa in terms of what are the numbers of food inspectors per population, let's start there. Are we even doing enough in terms of having the capacity to ensure that we get proper inspection over and above all the agencies that we have in South Africa? And moving forward in terms of what is our food safety emergency preparedness, because there's a lot that we still need to do. How many recalls are we having? Collectively, if we know the bulk of all of those details, we will move the needle in terms of making sure that where we pick up that there are challenges, how do we then turn it around? And this is something that, as the CGCSA, we're going to embark on. We've learned quite a great deal from the food loss and waste agreement that we put together, in that if we know where the challenges are, we can know how to unlock them. So as a country moving forward, whichever a system that we choose to go with, let it function with coherence, working together without duplication, because it is costing a lot. And I like the question that Isaac raised, in that some people, it's a pinch. And I think Prof touched on it in terms of, for us to expect the small suppliers or small players in the sector to maintain either your HACCP systems or this sophisticated type of food safety management systems, it could be a lot for them. It's anything comes to the money, because they are in business after all. So we need to find something that works for South Africa in all the levels of where the various role players are. Any system can work if we work together collaboratively.
You talk about finding something for South Africa, but is all chicken, for instance, inspected and tested at the port of arrival in the country? Every piece.
Every piece.
I'm joking.
Look,
but every imported package,
yes,
so to speak.
Every
container.
import, yes. Look, the imports are primarily handled by governments. So maybe that's out of my field. We deal more with exports, and we assist with certain imports. So whether every container is tested or not, I cannot answer with certainty. The Department of Agriculture, they do the import testing and release. It's still their prerogative. That's still their responsibility. And the help that we give is to assist them with that. So I wouldn't be able to give a clear-cut answer on that.
Thank you. Now, Jennifer Khatebe says we need to consider a cooperation and coordination mechanism that works for our environment. Food safety agency is just one of the options. From a FairPlay perspective, we agree with that, but we think a food safety agency, a national food safety agency with statutory powers, with real capability to do all these inspections and to do simple things as well. Perhaps the CGC is doing it already, but for restaurants owners, a possible solution could be a set of guidelines if they want to donate food, so that if they follow those guidelines, they can't be sued. But in the bigger picture, technology is going to be a vital part of a national food safety agency's work. Using, providing, and managing the technology to ensure, for instance, that imported goods comply with the same rules and regulations as local goods. So I think for FairPlay, this is a vital component, is to say technology combined with good practices, combined with proper oversight and governance combined with flexibility for small operators that doesn't impact on food safety. Now, to get that done, do you think enough is being done to get a national food safety agency off the ground? And what should be done to get it off the ground? How can different parties contribute and help government to get it off the ground? And I'm going to turn to Chris this time to say, Chris, you talked about government's role, but how do you see other parties assisting government to get the National Food Safety Agency off the ground?
Okay, I'm going to pick up on a few elements which have been said by the different speakers, the panelists, and which are relevant to your question whether you need a food agency. Okay, as I try to explain, the interaction between government, risk analysis, and the different businesses who have to implement all of this, try to reach those objectives. And they can be diverse, big corporates up to local SMEs, whatever. I mentioned integration, and I hear from Matlu coherence. I hear statutory powers. I believe you need your food agency not to do everything by themselves, but to make sure that they have an eye, monitor, stimulate, basically all the necessary interactions in that interplay between government and the different businesses. And mentioned a few times, inspection frequency. To be honest, in Europe, I know, I was involved in cases. What usually the food agencies do is risk classification of certain premises. And then they would pinpoint a certain frequency of inspection. I know small businesses who are only inspected once in 5 years. So there is an issue about capacity, frequency. If we say hygiene practices, good prerequisites, look, don't kid ourselves. Look at what we need to do for COVID. If you would simply, I always said, when COVID-19 came, we have to learn or teach everyone good hygiene practices as in food safety. Look, what is your main problem? Human behavior. All right, that's another issue. And then more important for your food agency. If we said that these companies or these businesses have to do a self-assessment, do testing, whatever, using these microbiological criteria, it's important that all that information at some way is come together under the supervision or whatever of a food agency, because the government cannot do good risk analysis if they don't have that information. And what is clear to me, if your food agency, one unit, can take care of what I call in the so-called IT world, the transformation from data into information, which we have raw data, we process them, we have information. How from information you go to knowledge. Knowledge meaning you bring experience, expertise from the inspectors or whatever. And then you can maybe go from knowledge to intelligence. And intelligence means you can bring in your artificial machine learning, whatever. We personally have been involved in the 90s in this kind of approach. And what you see in terms of doing this, there is not worldwide, food agencies have stopped doing all the inspections and testing. They subcontracted to labs which are accredited. I was personally responsible in Europe for such a lab. But then again, nice, it's a relationship between that lab and the consumer. But where do all these data come together to do that risk assessment at government level? That means you have to organize this. If a food agency takes care of the dynamics of the interactions, the motivation, the stimulation, leading to coherence, yes, you need urgently a clear one food agency, whether it's then decentralized, organized to gather the information. But to do so, it might be necessary to give them the authority and the powers to do so. That is essential if you want to really make progress. And again, as last comment, I realize it's not picking internationally what is available in the knowledge. You have to reiterate all what we know in science and in policies, whether it's Codex Alimentarius, to your local South African conditions. That's the responsibility of government, hopefully through the intermediation of Food Agency. I rest my case.
Thank you. Spoken like a good advocate for a national food safety program, really, not only a national food safety agency, to ensure that everyone participates in food safety, which is a point, Matlu, that you made as well. And Hein, you bringing the very important point of saying that unless we have the right technology and the right science, as well as proper inspections, this is going to be an uphill battle in the future. So there are people who still have questions to ask, and I'm sure we're going to answer them afterwards. But Dawn, I think we're almost at the point where we have to say goodbye. So why don't you say goodbye for everyone from our side on behalf of the panel? Thank you very much that you hosted us and that you did it so ably.
Thank you so much, Francois. It's been great to engage, and also just great getting all the insight from our panelists today. There is a number of questions that we'd still like to get to, and I'm sure the FairPlay team will be getting to that shortly afterwards. From my side, I'd just like to thank everyone for being here today, and I specifically want to say that they've given a lot of insight, even people within the agricultural sector, the farmers, food processors, agri-processors. I'm sure they've gained a lot from the discussion today. So thank you so much to everyone who joined and engaged in this session. Thank you, Francois.
Thank you, everybody. Goodbye.
Bye-bye.
Thanks.